Hi, so today we are going to talk about carotid artery stenosis. Now, carotid arteries are major arteries which are supplying blood to head and neck area. Carotid arteries originate from the area of aorta or aortic arch, and then they get bifurcated into internal carotid artery and external carotid artery at the neck level. Now, these arteries are the lifeline to provide blood, oxygenated blood to head and neck area, and if they get stenosis or if they get plaque or atherosclerosis, then it is going to cause issues like stroke. So there is a high possibility that if carotid arteries have stenosis, then the narrowing or the blockages will disrupt the blood flow to the important areas of brain, and it can cause ischemic stroke, which means the blood will not get the required amount of oxygen to function. Now there are people who are living with carotid artery stenosis, but then there are no symptoms, and then there are people who present with certain symptoms like blurred vision, numbness on face. In some cases, if the blockage is high, then the patient may also feel or exhibit transient ischemic attack, which means that there is some degree of ischemia or there is some amount of time where oxygen is not supplied to the brain. So patients who have already presented with such symptoms like numbness, vision loss or TIA, they must undergo evaluation for carotid artery stenosis. And then there are people who have never exhibited any symptoms, but then there are high chances. For example, people with uncontrolled diabetes or chronic hypertensives, people with other disease like peripheral artery disease, and people with known history of atherosclerosis or people with coronary artery disease, they should also get their carotid arteries tested by a doctor. The tests are very simple. They are not complex tests in terms of the non-invasive tests which are present. It can be done using a Doppler or a simple ultrasound. This carotid Doppler can tell the doctor that there is some blockages, although it has its own limitation. And then there are advanced tests such as magnetic resonance angiography and also catheter based angiography, wherein the doctor will inject some amount of dye in the carotid arteries to see the extent of blockage in these arteries. Now these tests are recommended by doctors depending on the symptoms, depending on the risk factor that the patient or the person is carrying. So it all depends whether you are an asymptomatic person but you have other underlying risk factors, you are in your 60s, you must undergo carotid artery evaluation. It just takes half an hour and it can be life-saving. Now let's assume if there is a patient who has been presented with carotid artery stenosis, what are the treatment options? There are two treatment options. One is surgical, where the incision is made on the neck area, the plaque is removed, and then it is stitched again. So this is called carotid endarterectomy. And then there is a minimal invasive procedure which is called as carotid artery stenting, wherein a balloon mounted stent is taken to the region of plaque and it is being accessed using the femoral artery of the groin. So there is less chance of bleeding, and this procedure can open the plaque because angioplasty is done and the balloon will inflate and make way for the blood to flow, and more oxygen can be provided to the brain and neck area. This also comes with certain risks, just like a surgery. This can also create a risk of peri-procedural stroke, or in some cases there is restenosis if the medicines are stopped, or there are other reasons in some cases. But in general, there have been studies which have shown that if carotid artery stenosis is treated aggressively, then the risk of stroke goes down by half. Now I was talking about carotid artery stenting and carotid endarterectomy. So there are pros and cons for both the procedures. More and more patients, more and more doctors are nowadays preferring carotid artery stenting because it is relatively safer procedure, less chances of infection, lesser bleeding, and also the overall recovery period. That means within 2 to 3 days you can go back home and carry on with your normal day-to-day life. Like I mentioned, there are patients who have presented with some degree of symptoms. There is data like CREST study, and then there is ICSS study, which is International Carotid Stent Study, which proves that if a timely intervention is being done, then these patients can reduce the risk of stroke by almost 50%, which is a very big number, because once you have already narrowing of your carotid artery and you intervene aggressively and you get it fixed, the risk of stroke goes down significantly. So then there are certain lifestyle changes that are being advised by the doctors. So it's not that the stent is being placed and the treatment is done. There are a lot of responsibilities from the patient side. Also, patient has to take care of the wound. There is some activity restriction. Weightlifting is restricted for few weeks, and then the patient should also monitor symptoms. In case there is any, he or she should report to the doctor immediately. Also, the patient is advised to monitor his weight, do certain number of steps a day, so that other disease like hypertension and further plaque formation can be stopped or inhibited. The most important part after carotid artery stenting is the continuation of medication, because all these antiplatelets like aspirin, clopidogrel, whatever is prescribed by your doctor, need to be given in order to continue to keep the stent open and provide unrestricted blood flow to the most important part of your body, which is your brain. So carotid artery stenting or carotid artery stenosis as a disease should not be ignored. If one has any symptoms or if one is high risk patient, one should go to a doctor and get a simple Doppler test done. Thank you for watching this video by Surgeons India. If you have any questions regarding stroke or carotid artery stenosis, please do reach out to us. In case of emergency, you can reach out to your nearest hospital or doctor. Thank you.